Hello everyone, and very warm welcome to today's session on pharmacy automation in Rehabilitation Center. Thank you for joining us. I am Ibrahim Khafagi. I'm the pharmacotherapy specialist at the National Rehabilitation Center, Abu Dhabi, UAE. So while we are waiting for a few more to join us, I will give you a brief about ISSUP. ISSUP is the membership organization with over 20,000 members worldwide, working in the fields of substance use prevention, treatment, and recovery care. So if you have not done so already, please head over to our website issup.net, where you will find information on how to sign up for free membership. ISSUP website also had a wealth of resources and publications for you to enjoy. You can also watch recordings of past webinars and see future event listing. I would like to thank the ISSUP staff for providing technical support for this event. So on behalf of the UAE chapter, today we will be presenting our first webinar in 2024. And our journey today will dive into pharmacy automation in Rehabilitation Center with our distinguished speaker, Dr. Muhammad Tashtoush. So Muhammad, very warm welcome to you. It is a great pleasure to have you with us today. So Dr. Muhammad Tashtoush, he has over 23 years. He is currently the manager of pharmacy section at the National Rehabilitation Center, Abu Dhabi, UAE. He has over 23 years of experience in hospital pharmacy practices. He commenced his career at King Faisal Specialist Hospital in Jeddah, where he was selected as the champion for medication safety, medication error reporting, and the management of code boxes. Previously, he held many leadership roles in various hospitals, including leading the pharmacy department at University Hospital in Sharjah and heading the pharmacy departments at Tawam and Al Ain hospitals in Al Ain region. Also, he founded the clinic-based pharmacist model and oversaw its implementation at the Behavioral Science Institute in Al Ain Hospital. Muhammad also he played a key role in planning and commissioning the pharmacy department at the new Al Ain Hospital STMC, introducing full automation pharmacy solutions for both outpatient and inpatient pharmacy services. His efforts earned the hospital the Distinguished Pharmacy Health Award in Dubai in January 2017. Earlier, he served as a medication safety supervisor and the quality coordinator at the Pharmaceutical Institute from January 2011. Also, he was chairing the Saha Medication Safety Committee in Abu Dhabi Health Services Company, Saha. So today we'll explore the impact of technology and automation on integrated patient care and the safety in the context of rehabilitation. So throughout this webinar, we will gain insight into understanding the diverse options and types of technology pertinent to pharmacy operations within a rehabilitation settings, recognizing the pivotal role that pharmacy plays in rehabilitation, and appreciating how automation may enable substance use professionals to focus on their key clinical tasks. And the audience, including ISSUP members, we need to promote the increased awareness surrounding the integration of technology in pharmacy operations within a rehabilitation settings. We will have some main elements that will be covered in this webinar: improve the patient safety, which is always the key focus in any healthcare settings, the technology era in hospital pharmacy automation, the types and options of hospital pharmacy automation, the impact of introducing technology on staff, patient care, and the clinical outcomes, and the impact on patient and medication safety by using technology. So before we get started, I would like to go over a few items so you know how to participate in today's event. You will have the opportunity to submit text questions so our presenter can later on discuss it after the end of the webinar. You may send on your questions at any time during the presentation. We will collect these and address them during the Q&A answers at the end of the presentations. Webinars and online events delivered and hosted by the ISSUP are provided for informational purposes only. They are educational in nature and they do not constitute medical advice, diagnosis, or treatment. And a recording of the webinar will be made available to you for you to watch on demand after the event. We hope you will stay with us for what promises to be an illuminating session. You will take away from this, if nothing else, a much more informative perspective of pharmacy automation in Rehabilitation Center. And now it is my pleasure to hand over to our speaker, Dr. Muhammad. Welcome to the webinar, and the floor is yours.
So, assalamu alaikum everyone. Good afternoon, everyone. And thank you, Ibrahim, for the great introduction. And I would like to thank the ISSUP for organizing such kind of activity. On behalf of the NRC and the ISSUP chapter at the UAE level, we're happy to have you on board to present the pharmacy automation and rehabilitation center that will show the moving forward the role of pharmacy in a rehab setting or in healthcare industry. So basically, first of all, I have to disclose that I have no financial relationship in regard of the solution that we will present in the automation. We will present only an experience, and I can say the highlights on the best solution that you can adopt at your facility. However, the selection is totally it's yours, and you're the decision maker in regard of selection of the vendors. Before we move forward with the pharmacy automation,
Muhammad, can you share the presentation, please?
It's shared. Is it moving?
It is not coming. One second. Yes, now it is there. Yeah, now it is there. Yeah, just come back.
Like now?
Yes.
Okay. So I can move forward, Rahim?
Yes, you can move forward. Yes.
Okay. So I did the disclosure, and moving forward, I would like to start introducing the National Rehabilitation Center in Abu Dhabi, UAE. So the National Rehabilitation Center, NRC, was established upon the insight of directive of late Sheikh Zayed bin Sultan Al Nahyan, God bless his soul, in 2002 to serve and provide a glimpse of hope for all drug addicts at the UAE level. We do have both outpatient and inpatient treatment program settings. The bed capacity, it can go up to 140 bed facility. We have a strong philosophy that the addict has to be defined as a patient who needs an ultimate care. We're adopting the multidisciplinary team approach to optimize the outcome from physician, nursing, social worker, psychotherapist, pharmacist, and pharmacotherapy specialists as well. Our key target in the pharmacy department is moving the pharmacy processes, I can say, or the pharmacy rule from a traditional pharmacy sales toward a pharmacotherapy and the clinical pharmacy rule within the multidisciplinary approach. We're trying to introduce the automation and technology at the NRC to follow the UAE strategy in adopting the artificial intelligence and the machine learning, where we believe that now worldwide and the global is speaking the same language of automation and artificial intelligence. In the agenda, we'll try to cover 5 key points of to the audience. We'll try to start with the technology era concept in hospital pharmacy automation. We'll cover the second point, the types and the option of hospital pharmacy automation. We'll show the audience the NRC assessment of pharmacy automation needs as a case study, the assessment we did at the NRC level, and the plan to automate the pharmacy or the medication management user processes. We'll highlight the automation as a value-based service for the healthcare facility. The last point will be about having some discussion about the impact of introducing technology on staff, patient care, and the clinical outcome. Slides are moving okay so far, Rahim?
Yes, there is a lag of 5 seconds, but it's okay. But now, yes.
So the expectation by the end of the webinar, the audience has to be able to know the option and the types of technology related to the pharmacy operation in a rehab setting and in general, a healthcare industry. He will be able to promote the awareness of using technology and the importance of using technology in pharmacy operation in such setting, the rehab setting, that will focus more on time and staff efficiency toward the clinical care and patient outcome. And the audience will be able to understand the role of pharmacy in rehab setting is not only a dispensary rule, and the impact of using automation to let the professional focus more on their key clinical tasks in an integrated patient care, which is our ultimate goal, to have the clinical care provided to our patient at the rehab center to be an integrated and multidisciplinary approach. I'll take you through the introduction about the automation in general, or as we all know that currently we're in the 21st century, where many factors are influencing the future of pharmacy practices as well as the healthcare industry to provide the best care to the patients. In today's healthcare provider, they are all of them are looking for new ways to improve the quality of patient care and to optimize the cost. Again, whenever we say the optimize the cost, it's not always focusing on reduce the cost. Optimizing the cost is totally getting use of the resources to the maximum. And this will enhance the employee retention and patient satisfaction. And even here, I would like to highlight that in the rehab center setting, we have to make sure that our system is capable enough to engage the patient in completing their treatment program, where we believe that the technology will help us in such kind of target. The artificial intelligence and the technology advances have led to the automation that's particularly significant to pharmacists from being a pharmacist, and it will be significant for all healthcare industry. Technology and automation should know and respond to the purpose for which it's executed, and because we're focusing more, we're introducing technology and automation. Whenever we're introducing technology and automation, we such kind of change, and we'll focus more on accuracy. The technology era in hospital pharmacy.
Your voice was not clear.
Okay, I'll try. Okay, now clear?
Yes.
Okay. So, what is the technology era in hospital pharmacy automation? Automation generally is introducing the technology to achieve the pharmacy operation efficiency and accuracy as well. The automation shall streamline the medication management process and the pharmacy operation all over the healthcare facility. Based on our experience, the most efficient practice in regard of the hospital pharmacy automation is the decentralized unit dose at the point of care, which is the nursing unit, by using the automated dispensing cabinet, and we will detail this in a few slides. Let me take you now through the medication use process and the potential automation. We all know that the medication management user process in the healthcare organization or healthcare facility consists of 4 main pillars, which are the prescribing, preparing and dispensing, administration of medication, and monitoring of medication. And we believe that there are potential automation or potential technology that can be added value to the key stages in medication management and user process. If I'm taking an example of prescribing, introducing the computer physician order entry will save time and will ensure that the medical record is completely accurate and accessible to all healthcare providers. In addition to the clinical decision support that's highlight the disease-drug interaction or drug-drug interaction or protocols, treatment, or order set that can be incorporated in the computer physician order entry to highlight the recommended, I can say, workflow or protocol to the prescribers. Moving to the preparing and dispensing, which is our key topic today, about the automation and introducing the automation in the preparing and dispensing part as part of the medication use process comes into the decentralized automating dispensing cabinet, a carousel technology at the inpatient pharmacy, or a centralized robotic at the main pharmacy, introducing the unit dose packaging system, and if the facility serving the IV and the TP and the intravenous admission and the parenteral nutrition compounder, they can even get use of such kind of technology. If the facility itself equipped with an pneumatic tube, again, that's considered one of the technology that will add value to the medication user process. In the administration, we highly recommend that the automation that can be incorporated in the administration is the barcoding or the barcode medication administration and the clinical support based infusion pump. Monitoring most probably the electronic clinical documentation that's available to all healthcare provider, and the monitoring criteria has to be automated within the health information system that you're using at your facility. As we all see that these are the key stages where the medication user process are most probably incorporated in. We strongly believe that the medication errors will be in control by introducing automation. Because as you can see from this slide, basically the medication error happened, I can say, into an equal responsibility with the multiple, with the disciplines within the healthcare environment, healthcare industry. So as you can see, around 49 of the medication error happening in the ordering part, administration around 26, dispensing, preparing, and transcribing around 20-25%. So based on the historical data provided by the automation, it assured that the medication error will reduce by introducing the automation into the pharmacy or the medication management user process. In regard of the goals and benefits from pharmacy automation technology, we can highlight it into four main areas. As I just briefed you before about our ultimate goal is to decrease the rate and the percentage of the medication error in all stages, and to provide pharmacists with more time to apply the integrated pharmaceutical care, the pharmacotherapy services, and provide the patient counseling. And when I would like to highlight the patient counseling importance to ensure the patient adherence to the medication given to him, especially in such kind of the service that we provide at the rehab center. The technology as well will add to save times, and at the end of this presentation, we'll share with you about the time saving when I can say the automation introduced for both pharmacy and nursing. We will show it specifically by time. That will, by default, will improve the patient and medication safety and control the diversion. In regard of the type and option of the hospital pharmacy automation available in the world, it's categorized into two main categories, which is the decentralized model, the automatic dispensing cabinet that will be located in the nursing units, and a pre-packaging solution in the pharmacy to replenish the ADCs. I'm not sure if the video will work. I'll give you, we'll try to check if the video is working. Ibrahim will tell me yes or no. If not, maybe we'll share with you the link in the chat, so you can, after the presentation, you can just take time just to see the video.
I think it's working, but there is no sound.
No sound?
No sound.
Okay,
so even you can just make it, you can make it through sound. You can make it. Yeah. You can comment.
Yeah. This is the decentralized ADC that will be located in the nursing units. And these ADC will be replenished from the pharmacy on a regular basis for all the medication that's profiled in the unit. This will give more time to the nursing to spend more about their clinical task with the patient. It will help us in control the stock and the inventory as well as it will provide us with the expiry report and tracking for the medication stored in the ADC. Yeah. So the ADC will save time to the nursing and give her more time to focus more on the patient's care. Moving forward to the second option of the pharmacy automation, which is the centralized model, which is almost a very, I can say, detailed robotic system that focus on the unit dose prepackaging and picking medications, and will prepare the medication on daily basis for the patient at the central pharmacy. Let us show you the video. This is the automated bill pick centralized pharmacy automation. This is the manual handling of medication and preparation in the unit in the pharmacy. The robot, as you can see, it's a huge one that equipped with many arms. Sounds working?
There is a delay. Just now the video started.
Okay.
I already shared the links, so maybe the audience can share it later. But now the video, you can, now it's okay.
Okay. So this is actually the huge robot to prepare the medication on daily basis to the patient. So the robot has all-in-one solution, is doing the repackaging. Again, the pharmacist has to check and ensure that the medication is rightly selected for pre-packaging. Then we'll prepare the medication in a unit dose packaging, all kind of dosage form. It has its own checking system, the robot, to ensure that the medication is being collected and packed correctly. As you can see, it has many robotic arms. Then the robot will prepare the unit dose as a patient specific. And will prepare the ring for the patient. As you can see, this ring will be for a patient medication for 24 hours. The first dose and the third dose has to be dispensed manually from the pharmacy. So if the patient treatment has been changed, such kind of return has to go back to the pharmacy and reuse it for another patient. And it controls the inventory as well. It has some advantage, and maybe we'll go into more details about the advantages in a few slides. So this is the return of the medication that's not used by the patient. Again, automation will save time for the nursing to focus more on patient care. Now the video is over.
Yes, you can go ahead. Now there is a poll. Yeah, there is a poll. If you can just see the video, you can choose which technology you would prefer for your facility, whether centralized or decentralized. Yes.
Maybe your decision might be immature, but however, it's good to have this. Yeah, it's good to answer this poll. So
we can see that 69% go for centralized and 31% for decentralized. And I believe, Muhammad, as you said, maybe it is too early to decide So I think by the end of the presentation, maybe you will understand more the difference between the pros and cons for each one. So you can, Dr. Muhammad, you can continue.
That's good. So what's the answer? Can you repeat the answer for the first poll, please?
69% go for centralized, 31 decentralized.
Okay.
So the more choose
centralized and 31. Okay, that's good. That's great. So continue the key difference with between centralized and decentralized. The medication stock has to be in the decentralized at least 3 to 7 days. However, in the centralized, the medication has to be located in the pharmacy and sent on daily basis to the units. Duration of access of the medication in this decentralized solution is available immediately for the nursing because it's available in the ADC. However, in the centralized, the medication is still in the pharmacy, has to be verified and sent to the nursing unit. So the decentralized will ease the access of the medication to the nursing. In regard of the cost saving, again, this is a long-term cost saving estimate, expected to save around 20 to 30% by the decentralized and 10 to 15% by the centralized. The rationale behind this is because of the huge cost of the centralized robot that you saw it in the video. I'll try to highlight here the pros and cons for each solution. I'll start with the centralized, which is the robot that will be located in the main pharmacy. The advantages are proper inventory and expiry control. Everything is being controlled there regarding inventory, stock management. There are no manual handling of medication during the cart fill, and it provides the accuracy and patient safety because of the technology used. It's fast processing time compared to the manual cart fill that some of the healthcare facility are using, that might take around 4 or 5 hours to prepare the cart fill manually by the human being or the pharmacist. It requires minimum check. Again, it has some, I can name it a system complexity. It has less nurse satisfaction because the delay of the first dose, because the nurse, they don't have access to the first dose. And the lag time for such kind of robot to prepare the medication for 24 hours. That might vary from 8 to 12 hours. Whenever you give the order to the robot to prepare the medication or the cart fill, it needs minimum from 8 to 12 hours to prepare such kind of medications. And during these 8 hours, if any changes of the treatment happen to the patients, the prepared medication has to be, rearranged or prepared again to accommodate the new treatment changes. It requires a huge number of staff required to deliver the carts because, again, still with this automation, you need to do a cart fill on daily basis. And you have to deliver the medication on daily basis, which is a unit dose packaging, to the all nursing unit you have. So imagine if you have, for example, 50 nursing unit, and the cutoff time for the cart fill is around 2 or 3 o'clock. So you need an army of staff to relocate or to deliver the medication to the nursing unit by using this centralized. A huge number of return of the pharmacy because of the lag time and the preparation time that the robot need, and doesn't accommodate refrigerating item. Okay. Moving to the pros and cons for the decentralized, which is the ADC. Again, the advantages focus more on the inventory expiry control because using the automation to everything will track and will be documented regarding the inventory, stock movement, whatever related to the inventory management. It's easy and timely access to the nursing staff because the medication are available at the nursing unit securely. The access to the medication is secured by the user security and after the pharmacy verification. It has the accuracy and the patient safety and ability to allow access to a single dose of medication because you will see the configuration of the drawers can help you to have only a single dose if needed. It reduced the resources that you used to have during the cart fill practice. It accommodates multiple dosage form, narcotic control, high alert, and you can highlight it using the system. It has less number of medication returned to the pharmacy because again we're replenishing the ADC using the medication as a unit dose, not as a patient specific. However, the central automation has to prepare the medication as a patient specific. It can accommodate the refrigerated item by using the supported lock to the fridge, and can be customized according to the medical service profile, consumption, and based on the change demand. It's a customizable. You can just set the profile based on the service that you provided in the unit. The disadvantages, those can be considered disadvantages, but again based on your planning part. The frequent filling of the cabinet. Maybe you have to replenish it almost frequently, every 2 days, every 3 days. So, and you may need more than one cabinet if you have more, if you have, I can say, a nursing unit or a ward with more than 25 beds. Internationally, around 20 to 25 beds need around one ADC. That should accommodate the profile. And this profile most probably will be medical and surgical. The beauty of the rehab center maybe that we help us in our case study, I'll explain it more, that the profile was very easy to configure because our patients, most of them are healthy, and some of them, they may have some chronic medications. So it was very simple and easy to us to define the profile to our automation plan. Benchmarking, show the benchmarking internationally about moving or the adoption of centralized versus decentralized, and this survey done in the States for around 400 hospitals from 2012 until 2016, and even the extrapolation for the coming 5 years that's reached up to 2021. As you can see, the point of care and the decentralized is moving up, where most of the hospitals are trying to adopt the decentralized, and the centralized is going down because again they already got the robot and they're using it. But however, future-wise, most of the pharmacy department within the healthcare industry are moving toward decentralized point of care, not the centralized. There are some hospitals who's using the hybrid, which is mixing both of them. But again, this depends on the bed capacity size, where I believe it should be minimum, again, from my humble experience, minimum of 1,500 beds if you're going toward a hybrid solution, because it's a costly and you need a volume to justify the cost and make it as a cost optimization project. We'll present now to you the NRC case study assessment for the pharmacy automation needs we did at the NRC. When we started the pharmacy automation, the rehab center, we decided that so far, and based on the setting of the NRC, we will use the unit dose dispensing cabinet, the automatic dispensing cabinet. We'll try to get use of the barcoding medication administration record to ensure the closed loop of medication administration and the medication management user process. We do have the computer vision order entry as our health information system that we can get use of it, and we'll introduce the carousel or the central pharmacy cabinet that's almost like to control the medications within the pharmacy department. The primary goals that we presented to our administration for the pharmacy automation at the NRC is to improve the medication availability at the nursing unit. We all know that the nursing, and I believe maybe we have some audience from our lovely nursing at the NRC, they're used to come every day to pick their medications, coming back and forth from the pharmacy to the nursing unit. This is a time that they have to utilize it more toward the patient care. It improves the medication administration process by nursing team by shortening the time to get the medication, because the medication will be available at their unit. It reduces the medication error and enhance the accuracy and medication safety. It improve and automate the report to our regulatory Department of Health and the NRC management, and it provide the medication security, and it will monitor the ward stock and the inventory. The assessment rationale that we did at the NRC, it was based on the current drug distribution system gaps identified at the NRC based on the experience of the effectiveness of the pharmacy automation in such setting, and the potential of automating medication storage and dispensing process to achieve the security of medication and the inventory, the medication safety, and control any potential diversion. So this is what I can believe summarize the rationale behind the assessment that we started to assess if we're going toward the automation at the NRC or not. These are sharing some figures with the team on how we build our data. So basically we have 7 main units. Average capacity around, I can say, 15-20 beds, and the number of the line items that will be stored in the cabinet. And here the beauty that I mentioned, maybe the beauty of profiling such kind of ADC at the rehab center setting, because most of our patients, I would like to repeat again, most of our patients are coming here for the service of treatment program from addictions. The medication, most of our patients, they're using the same medication. Some patients, they may have some chronic medication. So when we started with the nursing team, I would like to thank the nursing team who helped me in profiling the ADC or the automatic dispensing cabinet for that project. It was very simple to us to identify the number of the line items. There is no more, there is no duplication. There's no frequent changes of the profile. So it helped us exactly to identify the needs for our automation. So as you can see, we have 7 units. We allocated 7 full-size ADC units. We have VIP units, 1. We have Vela units and OBD, where we allocated a small size, which is called tabletop ADC, that will accommodate around 15 to 20 drugs. So we agree that the automation requirement can be summarized by 7 main full size, 7 tabletop, and 14 fridge lock to be connected with the ADC. At the pharmacy, we will have 1 main narc vault or narcotic cabinet that's equipped with a main brain and pre-packaging machine that will prepare the unit dose that will replenish the narc vault as well as the ADC, and fridge to be connected to the narc vault. These are the ADC or the cabinet that we will have it in month time at the NRC. It's a full size, as you can see, or tabletop. The tabletop for the small units that accommodate 15 to 20 line item, and this can accommodate up to 100 items. It's equipped from shelves, brain or computer, touch screen, drawers, and I'll show you the locks, scan either by fingerprint, and the barcode scanner for picking medication and replenishing the medication, and it's equipped with external return bin for return medication if it will be used. These are the key function in the ADCs at the NRC. It has a guiding light for the drawers as well as for the bins. We have different, I can say, storage space and different layout of the drawers at the NRC, and since most of our medication are controlled, we selected all of them to be high-level security. All has to be lidded, has to be closed by lid. This open matrix, to be honest, I'm not recommending, because it's given access to all medication at the same time. However, this will give you an access to only the medication that you need, along with the fridge flex lock that will be connected to the fridge and make the fridge accessible by the ADC. The value-based service for pharmacy automation. Do you believe that the pharmacy automation will be an added value and can be named or flagged as value-based service? Basically, I can say yes, but I have to declare that the medication error is always under reporting in a healthcare setting. It's either the near misses or even the that might reach the patient. The benchmark data assure that the automation will reduce the medication error. Actually, the NRC will implement the automation within the coming 6 months. It will have full implementation, and we're happy to share the data before and after for the ISSUP community. So the pharmacy automation and the positive impact of the automation, that it will improve the accuracy and dispensing process. It eliminates the selection error and reduce the medication error. It reduces the dispensing error to improve patient safety. The ADC, which is the cabinet, will provide a secure medication storage and accuracy on patient care units. Automation will improve the stock and inventory control and control the diversion as well. Automation, the positive impact will focus more on time efficiency, staff efficiency, not only for pharmacy, but only for nursing. That will give us more time to focus more on our clinical activity toward patients. Maybe that's few slides will focus more about the save nursing time by introducing the automation. Again, our key ultimate goal is to optimize the total cost of medication-related activity within the facility.
Dr. Muhammad, we have a poll here for to what extent do you believe the automation will be a value-based service towards patient safety in your facility?
Yeah. So I'll move forward.
No, just wait. We'll give 1 minute for.
Okay.
Now we are receiving the votes. Yeah.
Great. So.
Yes, we closed. So now we'll see the result now.
Yeah.
So 51% go for strong, 40% for moderate, and 10% for mild.
Okay, that's very interesting. Okay, thank you very much. I mean, again, strong and moderate, they feel that it's a value-added base to the healthcare industry, which is, I believe, that's fair enough to judge. We'll move forward with the impact of the automation on the manpower. We're always thinking about our job security, and whenever you introduce the automation or the artificial intelligence, that okay, we'll lose our job. Or I believe I would like to name it that this is a myth. It's totally a wrong perception that the automation will reduce the manpower, because again, who made the automation is the human being. So the pharmacist, whenever we're at the pharmacy department levels, the pharmacists always fear that the automation will decrease the number of job opportunity. It may decrease the number of positions or for pharmacist technician where they're doing only preparing and dispensing. As a pharmacy leads how to act, I believe. Yes.
For the presentation, just it is not showing. Yeah, just 1 second.
Now.
Yeah. Now okay.
Now. Okay. So actually, it's a myth. So as a pharmacy leads, we should be able to show the value of and the quality of integrated pharmacy patient care and the automation introduced to the system, to our administration. We should look on how automation will open a new role for pharmacists rather than deleting their rules. And new rules, when we're saying, we're almost referring to the pharmacy informatics and the pharmacists who specialize on automation. The automation provided the pharmacist with an opportunity to work more closely with the patient, focus more on their clinical role toward patients to assure the appropriate drug therapy and the outcome, patient counseling, adherence, pharmacotherapy consultation toward the patient. So these are the clinical activities for the pharmacy, not only a dispensary part. There will be always the need for pharmacists to identify, solve, and prevent drug-related problems and handle technology, as I just mentioned. Okay, this is like a quick question where I believe we all ask ourselves about, do you believe that the safety with automation will achieve 100%? Again, there's no yes or no answer here. However, we strongly believe that the automation has a major input to reduce the medication error and save time by reducing complexity, simplifying and standardizing the process, avoiding the over-dependence of the human memory. And we know that the human memory, many of us are facing memory issues, improving efficiency for all staff. And this has to be incorporated and if properly integrated with the HIS. However, if it's not used properly, the technology, it can produce a new source of error. Automation can instill a false sense of security, might lead to carelessness by staff. So if the carelessness of the staff is there, regardless if there is an automation or no, the safety is an issue. Implementing the technology takes years to accomplish, with the needs of a dedicated employee. We need the buy-in from the employee to ensure the right implementation of the technology. And all healthcare providers or professionals and patients must understand that the technology cannot completely substitute the human being value, because we are the human being who brought up the technology. This is a very interesting study. I would like to share it, and the reference is from the Omnicell. They at the UAE, they did a very interesting study, a real and observation study, and the impact of automated dispensing cabinet to the medication workflow for the medication management and user process. They had a nursing around 700 staff and the pharmacy about 50 staff. The time impact on collecting initial dose, around 48%, they need more than 30 minutes, and 52 15 minutes. This is to collect the medication before the ADC. After the ADC, most of the medication will be able to, nurse was able to collect within 1 to 5 minutes. Missing medication, we always know that the nursing are experiencing challenges in the regard of missing doses or missing medication, and this is around 61%. However, after introducing the ADC, around 3% who face a missing medication, and this most probably related to the profile, the corrective profiling of the ADC. In narcotic documentation, we know the narcotic endorsement and the shift endorsement between the nursing. It takes minimum of 25 minutes to 30 minutes. With automation and ADC, we can automate this one and move to the paperless narcotic documentation, and it's approved by Ministry of Health at the UAE and the regulatory body at the Abu Dhabi. Average time spent on the medication-related task, around 80% of the nursing spent around 1 hour from their shift only related to medications. However, with introducing ADC, 90%, almost around 5 to 10 minutes, I can say, per shift. And this is if I'm just converting this time saving to a full-time equivalence for nursing staffing, it's around 1 FTE, which that you need 1 FTE totally to handle the medication management process before the automation. However, with the automation, this FTE will focus more on their nursing care to the patients. In regard of the pharmacy and the time saving, again, by the card filling, around 2 hours we used to fill the card filling. By introducing the automation, will make it around 15 minutes if the medication is not profiled in the ADC. Checking the floor stock manually before automation, it was around more than 1 hour. The pharmacy has to spend to check the word stock and the medication available in the units, about the expiry, the inventory. However, with the automation, all of these will be available at a single click by the software that you have. Documentation for narcotic at the pharmacy level, more than 30 minutes. We're moving with the automation with the paperless documentation approved by the regulatory bodies. So as you can see, the impact of automation, automated dispensing cabinet on the medication workflow save time for nursing, pharmacy, as well as all other involved, to let them to focus more on their activities toward patient care. So which automated technology should be selected? And this is maybe will bring me to the first polls we put it, where 69 of you selected centralized or 31 selected decentralized. And I'm very happy to see these figures, and maybe we recommend to repeat the polls again at the end of the presentation to see if you change your mind or not. However, to answer the questions, there is no right and wrong answer. It depends on your facility, it depends on your size of the facility, the budget, and how they're carefully integrated within your system. The ideal system you need has to focus more on the patient care, safety benefit, responsiveness to the customer and the patient needs, as well as the cost effectiveness. Before implementing any technology, I would recommend to check the advantage, the disadvantage, go explore, search, like whatever, Google it, check with the experts before taking the final decision of which solution you need to implement. And must always remember that the importance of the pharmacist role in overseeing and coordination such system and the medication management process from the healthcare concept, I can say. And we have to focus more on the pharmacotherapy role in an integrated and multidisciplinary approach with different team members. In a summary, what I would like just to summarize what we went through, and maybe I'm not sure if we have another polls, Ibrahim.
Yes, we can have the last poll now before the summary. 1 second.
Okay, so let us put the last poll, and after the summary, we can repeat the first poll. We have time.
Yeah. Do you believe that automation will have a negative impact on job opportunities? So it is a 60-40. 40 for yes, 60 for no. So you can comment and go for the summary. So it is 60-40. 60
so again,
no,
can you
40
repeat the
yes.
answer?
60 no.
60 will not
Do you believe that
will not affect
40 yes, it will affect.
Okay. Again, I believe these 40 has to change their mind. I strongly believe you have to believe in yourself that you cannot be replaced by an automation. To be very honest, because again, the automation is there. Maybe we have to I can say upskill ourself or upgrade our knowledge to ensure that we're adopting the technology and we're part of the technology. That's what I can comment, because I'll try to repeat again that who made the technology is a human being. And whatever technology you have, you need a human being to focus to monitor this technology outcome. Is it the right thing or not? To adjust that technology, to assess the impact of technology future-wise. And this, by default, need a human being. So again, I would like to keep naming it as a myth is not a real, although some people are feeling it as a real. In a summary, we're entering the new era of pharmacy technology, where I believe we have to speak the language of technology and artificial intelligence. There is no perfect technology, and all systems must be managed to provide the best outcome based on your assessment and based on your needs. To be successful in the future, as I mentioned, maybe the pharmacist upskilling our skills. Pharmacists must view the automation to encourage the productivity and efficiency as the desired goal, not as a threat to their work. And every change must be implemented with an understanding that even good changes can create an unexpected hazard. These are, I believe, we're done.
Your presentation, yes. Yeah, just because the presentation was
maybe,
not there.
Yeah.
1 second.
Yeah. So now. So I'm not sure if the audience allow us to repeat the first question again, the first polls. Can you repeat it, Ibrahim?
Once closed, we
While
cannot.
we're waiting for questions.
No, we cannot close.
Okay.
There's only one time. We can.
Okay. So can we just do it again to see? Again, don't let the NRC case. Please don't let the NRC case to affect your decision. I mean, I presented
once
again.
the polls is that the polls closed. We cannot repeat it again. There's only one time.
Okay. Anyways, okay, that's good.
So thank you very much, Dr. Muhammad, for this insightful presentations, and we are now going to see if there is any questions submitted during the presentation. And you can still submit the questions through the question ban in your attendee control panel if you want to ask any questions.
Yes, please, Ibrahim. Ibrahim, let me comment here. As I mentioned, even if we're unable to repeat the poll, however, again, the 69 and the 31%, it's a perception, I can say. Continue your perception, assess your needs. Do not let our case to affect your decision, because you're linked with your facility, your requirement at the facility, and as well as the budget, the size, and your perception. Moving forward with the centralized is one of the good options. However, I can see that the centralized might be one of the best if we have a rehab center that can that accommodate around minimum of 1,500 or 2,000 bed, which is, I'm not sure if it's available somewhere. Yes, Ibrahim, do you have any questions?
I think also the matter of the cost. Yeah, the centralized is, we need, I think, to mention that the cost is very much comparing to the decentralized, and maybe almost 10 times. I think 10 times more than.
Yeah, minimum
if you're
of,
going
I
for
can 5 to 10 times. It depends on if compare.
And the user friendly, decentralized is more user friendly for the nursing and the medication with them. No need. I believe, but it is not, as you said, no, it is not, one size does not fit all, and every facility should assess their needs, and they have to choose pros and cons for according to their situation.
Yes. Do you have any questions in the chat or the question box?
There is a question: how to improve the God perception, more digital education?
How
To improve the God perception more, that maybe we need more digital education. She's the question for how can we do more digital education as an
such
automation
kind of
part?
platform, I mean, such kind of platform help us in improving more education related to the technology. We have to explore the technology available within our profession, like being a pharmacist, being a nurse, being a physician. Let us explore. You know, the trend of the artificial intelligence and the machine learning that's coming now. It's a done deal. I mean, to be honest, maybe some of jobs might not be there in the coming 5 to 10 years. Where I believe, again, focus more on upskilling our knowledge to ensure that we can, let me name it as, survive within the job. However, it's like you're the one who's controlling yourself and who's putting yourself on the right track in your career. Yes, Ibrahim.
I believe there is hand raised, so we can take. I think it is. Yeah, we are out of time, but I think for Julie, yeah, I will. I don't know how to give her the option to. Yes. I don't know. Julie, you can if you want.
Can you hear me?
Yes,
Yes,
Julie.
you can hear you. Yeah.
Okay. No, I was actually just going to put in, I hit the wrong button in the first place. I was just going to put in a comment for the end of it. It was a very sophisticated what's the word I'm looking for? It was very sophisticated in terms of what was brought to the actual training this morning. I think when you come from a small place like Ireland, something like that type of sophistication in reference to the new technology, like you know, we have such small rehab centres in Ireland. They're not very big. They don't hold a lot of beds and all that. So we're not up to scratch on that side of it. It wouldn't. I don't see it as being something that we would consider implementing unless there was a centralised treatment centre where you had included a pharmacy. But it is very insightful, and I think it is the way forward in many ways for big companies. And thank you for the.
Yeah. Yeah, I totally agree with you. I mean, the small center, again, maybe it's not doable, again, the budget. However, if you have a centralized, again, my humble recommendation here, if the facility is equipped with more than 100 bed, 120 beds, it's good to think of the automation. This might be a cost optimization project. 50 or 60 or 30 beds, most probably the automation might not be the best solution. Based on your judgment at the end.
Yeah. Thank you.
Thank you.
Thank you. Thank you. There is another question from David. I see you have an OBD, but does that allow patients to receive daily dosing if you use DOT for medically assisted treatment? I think his question about the direct observed therapy for medically assisted treatment. So does the automation, how can the automation can do that?
Again,
I believe, Dr. Muhammad, if you remember the video observed therapy, I think you have this model, right?
Yeah. Yeah, but I mean, we already equipped the outpatient department with an ADC. So if there's a medication on the patient coming on daily doses, the medication will be stored within the ADC premises, I can see, and can be accessible to the nursing once needed. So even in the OBD, we allocated one ADC for either the medication given in the clinic or for such kind of treatment.
I believe also the option for recording 30 minutes for while the patient is taking the medication can support the direct observed therapy. What do you think, Dr. Muhammad?
Yeah, might be, but this again, this is part of maybe the future project that we're.
Okay. There is another question from. What is in place to help Africa implement this new approach in our rehab facility? From Muhammad Lamin.
Where in Africa, first of all? I mean, basically, again, this depends on the facility size and the budget allocated. Still, there are some. See, let me share with you my recommendation here. To be honest, the cost for such automation was minimum more than 3 times 5 years back. But the competition are coming because the technology are being copied by many other vendors, where it brought the price of such kind of automation down. And I can recall almost 5 years back, the things that was with 7 million or 6 million, now you can get it by 2.5 million. Imagine, because of the competition. I'm always naming that the competition between the vendor is healthy, where we have to get use of it.
Yeah. Sure. So most probably even the budget, within the next years, with the digital era, everything will be easier.
Yeah. I totally agree with you, Ibrahim.
Okay, so I think we are out of time now. So thanks again to Dr. Muhammad for answering the questions and for this great presentations. It was a pleasure to have you with us. So now we can conclude our webinar. Thank you all for attending. We hope that you learned something new and enjoyed the presentations. You will receive a follow-up email within 24 to 48 hours with a link to view a recording of today's webinar. We always appreciate your feedback and suggestions. Please use the link in the follow-up email to fill out the feedback survey. So on behalf of ISSUP and our presenter, thank you for joining us today and have a great rest for your day. Thank you very much.
Thank you. Thank you, Ibrahim, for moderating this.
Thank you, Muhammad. Thank you.
Thank you both.